Childhood obesity remains to be a nationwide problem in the United States. There are various types of health effects of childhood obesity. In an episode of The Simpsons, the son, Bart Simpson, states, "When I grow up, I'm going to be a lardo on workman's comp just like Dad," which reflects patterns of obesity. In reality, many obese children will become an obese adult or suffer from other medical health issues as a child or later in their adult life. There are several different types of childhood obesity effects. Some effects are detected immediately in young, obese children. According to David Lewig, an oncologist and associate professor of pediatrics at Harvard Medical School, he states, "Obesity affects every organ system in a child's body, and it can do so in a much more profound way than in adults because children are still growing and developing." Obese children carry excess amount of weight, which affects their health, leading them to an increased risk of high blood pressure, high cholesterol, and type 2 diabetes. Experts from the Centers for Disease Control and Prevention have conducted a study and have found, in a population-based sample of 5 to 17-year-olds, 70% of obese youth had at least one risk factor for cardiovascular disease. At one time, cardiovascular disease was commonly found in adults. However, due to the increasing rate of childhood obesity, cardiovascular disease has become a common health issue in young, obese children. Lewig has also found that obese children have excess fat in their liver, which could lead to hepatitis, cirrhosis, or liver failure. Obesity in children and adults increases the risk of type 2 diabetes, which can lead to sleep apnea. Sleep apnea is a sleep disorder in which breathing is interrupted repeatedly, disrupting the quality of sleep and leading to daytime fatigue. Childhood obesity effects can also occur later in their adult life. It is likely for obese children to become obese adults. The author of the article, Lifelong Effects of Childhood Obesity, interviews Dr. Kirsten Bibbins-Domingo, an author of one of the New England Journal of Medicine studies, and her colleagues on childhood obesity. Bibbins-Domingo and her colleagues have researched childhood obesity rates from the year 2000 and have predicted by the year 2020 that 44% of American women and 37% of men at the age of 35 will be obese. Dr. Bibbins-Domingo states, "We have found not unexpectedly that the prevalence of heart disease will rise by as much as 16% and heart disease deaths by as much as 19% between the ages of 35 and 50 years. From Bibbins-Domingo's research, the article estimates there will be about 100,000 more heart disease deaths among 35 to 50-year-olds due to obesity. As long as the childhood obesity rates increase, the effects that are linked with this health issue will increase as well. It is important for young children, adolescents, as well as adults to be aware of the health effects of childhood obesity. These health effects can be damaging to their health early in a child's life and or later in their adult life. For more information on the health effects of childhood obesity, please visit www.cdc.gov.